People suffering with long-term health conditions often need the help and advice of several different health professionals. This can mean a number of trips to surgeries and hospitals over many months. To make this process simpler and easier, a pilot scheme in East Hampshire called a Carousel clinic is being developed. A Carousel clinic simply gives the patient the opportunity to see all those health professionals on the same day within their own GP surgery. Each different clinic concentrates on different health areas. One of the first was a respiratory clinic held at Badgerwood Surgery.
Patients came along and saw the specialist, a specialist nurse, sometimes a pharmacist, sometimes a physiologist.
And you were tested for your breathing, you were tested for how you used an inhaler, were you using it correctly?
And we had 10 stations of different people, a nurse, a smoking cessation advisor, and the patients just rotated around all of them.
As a team, we met and we discussed each individual's care pathway. Patients were then invited in for a follow-up review on that same day to give them their self-management plan so they knew exactly what they needed to do.
The other benefit, which has been really good, is that our practice nurses had the opportunity to go into the team meeting at the end, and the learning, they said, was absolutely fantastic. So they've taken really good things from that they're going to use in their day-to-day jobs.
And we also had the support of charities, and the charities we invited were pertinent to the disease area. So when it was COPD, we invited in the British Lung Foundation, and for asthma we had Asthma UK and Allergy UK.
In terms of the patients, they got to come to one place, they saw all the people they needed to in one trip, and they went away with a diagnosis or an answer to their problems.
Has it gone down again? I was extremely ill, and it was thought that I could possibly have COPD. And they actually came to the conclusion that I didn't have COPD, which was a good thing, but that would never have been discovered if I hadn't had the intensive and specialist care and investigation that I had then.
We found that people need less medication. They've been in hospital fewer times, fewer exacerbations, and patients really love the convenience of it.
Everybody was delightful, and you had one-on-one attention, which was great. You know, it really made you feel very special, I suppose.